Dr. Rashid, take one.
So I'm a huge sports enthusiast and played almost every sport you could name when I was at school. As I transitioned to university, the sports that I really pursued were football, basketball and squash, which I was fortunate enough to play for Imperial College. But that's actually given me an insight into sports injury, and a big proportion of the patients that I see are sports people. I'll always go up and read up about these sports and try and understand the mechanics of injury, the pathophysiology of injury in these sports. I think if you go into a consultation and you understand the sport and you're able to use terminology that's specific to that sport and really show an understanding of how that patient has been injured and the necessity to address that injury in a very specific way so you can return them to playing sport at the pre-injury level, it establishes a very good rapport with them. So for something like tennis elbow, for example, which is probably the most prevalent condition around the elbow, the majority of patients were able to normalize their symptoms with very simple non-operative measures such as patient education, application of appropriate pain management strategies, and onward referral to physiotherapy, and usually some modulation of the activity that they're doing. So if a patient's attending our one-stop clinic to treat an elbow injury, for example, they would book in with my team and they would have an initial consultation with me, which consists of clinical assessment and some diagnostic imaging. We're usually able to secure an imaging slot in radiology for them for whatever their imaging requirements are, whether it's anything from an X-ray to an ultrasound, a CT scan or an MRI. We're usually able to provide that on the day. Then we'll see them back on the same day after they've had their imaging, and a radiologist has been able to issue a formal report on their scan. And we'll give them an answer there and then. If they require a minor intervention like an ultrasound-guided steroid injection, we're also able to provide that on the same day, or alternatively direct them to physiotherapy. And if they require surgical intervention, we can usually plan it within a very short space of time. I chose Johns and Lizzie's because there was a much less corporate feel. It feels like a hospital that's been serving the community in North London for a long time really, really well. Patients really love that hospital. I think that the patient feedback is the single most important reason that drew me to the hospital. We have a fantastic infrastructure for aftercare, excellent quality nursing staff, to inpatient physiotherapy. If someone's had persistent pain despite a number of very simplistic measures that you might try, but they're not getting any better, pick up the phone and call the booking center at John and Lizzie's and get into one of our elbow clinics. Often the reason that patients are not able to come in is because they're busy. Our clinics start before 9 o'clock and they end after 5 o'clock, so we're quite flexible in accommodating patients.